Okay, so today I'm going to be talking about ergonomic safety for the GIS technician, although everything I'm going to be talking about does apply generally to anyone working in an office. So what will you learn today? By the end of this presentation, you should know how to design your own safe workspace tailored to your own personal needs and requirements, and you should be able to identify why ergonomic design is important and critical for personal and occupational health and safety. Here's just a self-test that you can do to determine what you know before you go through the rest of this presentation. So what are ergonomics and why is ergonomic design important in the workplace? Ergonomic design acts to conform the workplace and all of its elements to the worker in order to actively improve the overall health, safety, and productivity and morale as well of employees. So approximately 1 in 3 workplace injuries actually resulting in days away from work are related to poor ergonomic design. And that's a worldwide statistic. So ergonomic planning and design can be implemented into the workplace in order to actively minimize the amount of physical stressors and also mental stressors imposed on the worker, which ultimately results in fewer workplace injuries and health problems. So why should you be concerned about this hazard in particular? You might think that ergonomic safety is a little bit less of a priority or less of a hazard than other ones you might encounter. But since you do encounter it on a daily basis in the office, it's important to know your risk factors. So you have repetitive and prolonged activities, prolonged static posture, your repeated gripping or grasping with the hands, or awkward posture in the upper body. Also, cold temperatures tends to increase the rate of any sort of like stress or musculoskeletal issues that you might have in your body. Joint and musculoskeletal disorders can result from extended periods of time, essentially, in improperly designed chairs or handheld mouse devices, as well as just incorrectly positioned computer monitors. So that can cause a bunch of stress in your back, shoulders, and arms, and it can cause excessive strain all over your body. So poorly designed workstations can result in any of these the following, but they're also not limited to, so they can also include other things. But these are just the most popular or the most common ones. Particularly strains and sprains are recognized as the most common type of musculoskeletal injury, and they actually comprise about 40% of all lost time occupational injuries. Repetitive strain injury, the SRI, is the most common type of hand injury in Canada, caused by repetitive movement or motion. So like typing, using your mouse or using any sort of grasping tools in an awkward way, or just in a prolonged, if you're just exposed to it in a prolonged manner. Carpal tunnel syndrome is also very common. It's the most common hand and wrist injury in Canada, and it's caused by the compression of the medial nerve. Pretty much it's induced by prolonged activity and flexing of the wrist in awkward positions. So we're going to go through training now, and this is just going to be an overall 5-step procedure determining how you design your own. You can design your own ergonomically safe workspace. So step 1 is obviously ensuring proper seated posture. I'm sure this is a very common problem that a lot of people have, including myself. So for starters, you need to make sure that your chair is adjustable and has the following adjustable characteristics. So first of all, your backrest, of course, should be adjustable in a perfect world, both vertically and horizontally, in the backward and forward direction. Or just make sure that your back rest flat against the backrest. So you have the greatest support and the greatest pressure in your lower lumbar. So that's like the greatest curve in your back, obviously. It's your lower lumbar. And also make sure, this is also really important, make sure that when you're seated deep in your seat with your back flat against the backrest on the back of the seat, your feet should be resting flat on the ground with your knees at a 90-degree angle. You should also have an adjustable seat height range. If you're shorter, as I said before, you should make sure that your feet are resting flat against the ground, but if you're shorter, you might need a footrest to ensure that you're not putting excessive strain on your lower back. Footrests are also really important to have if you're shorter because they can also promote adequate blood flow and circulation. So if you're sitting with your feet dangling all day, you might be at a higher risk of developing blood clots because your circulation's not as good as it would be with the footrest. Armrests are also very important. Make sure that when your shoulders are rested, relaxed and by your sides, they should be at a 90-degree angle. And this is also really important when you are typing. Lastly, the stability of your chair. You should always have a swivel chair with a 5-point basis. Just make sure that if you have a swivel chair, it actually puts less pressure on your hips as opposed to a non-swivel chair. So that's important too. So step 2, this is ergonomic safety, specifically with video display terminals. So any sort of like electronic device, including mostly computer monitors and computers. So first of all, keyboard use. You should make sure that when you're typing, you should essentially have a keyboard tray to make sure that your wrists are in a straight line with your arms when typing. And your keyboard should be either level or tilted slightly down, but they should not be tilted towards you because this could put excess pressure on your wrists. It can cause, or it can increase the risk of developing those musculoskeletal injuries that we talked about at the beginning of the presentation. Now your mouse, you should make sure that it's, if it's comfortably in your hand and it's small enough, making sure that your fingers stay relaxed and slightly curved. It should also be close and level with the keyboard. Your monitor should be placed at an arm's length away from your face, straight ahead of you. The top of your monitor should be raised or lowered to make sure that the top of your monitor is at eye level, not any higher or not any lower, because that could put either excess strain on the neck or it can promote slouching. You can also use any sort of tools or devices if you tend to switch between reading on a computer screen and reading like documents or any sort of paper documents or paper that's resting on your workspace. Step 3, this is just general safety protocols with any sort of seated repetitive work that you should be making sure that you're doing. Essentially, just the most important thing is make sure that you are avoiding stagnancy. This is always something that we all tend to overlook, but it's also very important for physical health and also your mental well-being and your productivity. So just change your position often. I find it pretty helpful to set a timer and set small breaks every 30 minutes to an hour, just to walk around to increase blood flow and ease stress on the body, and also to avoid eye strain. When avoiding eye strain, they say that you should be doing the 20-20 rule, so looking at a distant object at least 20 feet away from you every 20 minutes to make sure that you avoid eye strain. And this also helps with productivity in the long run. It's also quite helpful to rotate between tasks. You can also do this by kind of cooperating with your coworkers, and this breaks the monotony and repetition of your work. So you and your coworkers can rotate through different jobs throughout the day if that's possible. That tends to help as well. And just be sure to speak with your manager in the workplace to address any concerns, or if you have any physical stress, particularly, especially during your shift, because they might be able to help you assess your personal needs and make adjustments to your workspace or workload. Make sure you do this sooner than later, especially if the pain is increasing in severity. So designing your work zone. You should ensure that your desk is properly designed according to the appropriate zones of movement. So you should be coordinating everyday movement patterns with the certain zones on your desk. So your keyboard, mouse, and other items used most often should be placed in the primary zone. Items used less often should be placed in the secondary zone. And items rarely used on a daily basis, like documents that are used for reference that you rarely use, should be placed in the tertiary zone. And let's just make sure that you're staying upright and in a comfortable seated position, putting the least stress that you can on your back throughout the day. So the last step is just generally making sure that you're being aware of your own personal needs and requirements physiologically and mentally throughout the day. Because obviously, ergonomic design is not a one size fits all concept, although there are general standards that you should comply with. So you need to assess your own needs and be aware of what you might need on a daily basis. So just be aware of any back or shoulder or neck pain. And if the pain continues to, just reevaluate your workspace and make sure that you're following, your work zone and making sure that your chair and your posture is okay. And just make sure that you are talking to your manager if you need to in terms of any sort of pain that might be recurring or getting worse. It may actually be helpful sometimes to keep a log or a monitor if you do have any susceptibility to any pains, or if you have a history of any sort of musculoskeletal issues or injuries that might be affecting your work. Just keep a log of what you're doing day to day, and see if you can kind of adjust things from there. It's just helpful to be aware. And yeah, don't look past proper communication with your coworkers and supervisors. Just if you do have any sort of recurring pain or anything that you need to rectify, because it is your right as a worker to ensure that you're working in a stress and pain-free environment, and just voice your concerns sooner than later to minimize the risk of lost income and time off work. So here are some questions for you guys that you should be able to answer now. You might need to refer back to the video if you need to. So question 1, select all risk factors associated with joint and musculoskeletal injuries. So just select all that apply, and you guys can pause and figure out your answer from here. Answer are here highlighted in bold. Hot temperatures are not correct. Remember, as I said before, it's cold temperatures that increase the risk of any sort of physical stress. And wearing gloves is not a specified risk. Question 2, the same thing as question 1. Select all that might result from an improperly designed ergonomic workspace. Here are the answers. These are the correct responses. Question 3, what is the most common workplace musculoskeletal injury? And of course it's sprains and strains. Question 4, just go through select the following statements that are true regarding the characteristics of a properly designed chair. Here's the answer. Everything is correct except for stability, as it should be a 5-point base, a swivel chair as well. So question 5, is this one true or false? And the answer is false, as you should be choosing or placing items of rare use in the tertiary zone. And thank you for watching. Enjoy the meme.